Look at that dog.
So once Jeff gets into position, I'm going to reset that light.
Holy, get down. That's rude. Watch the light.
Hey, did you pick your armband yet? So, for his armband to cover his pick line, now I do like the feng shui of this one with the jeans. But this is always my favorite. Good classic. So, my dad used to wear the armbands they provided at the clinic. They're really, his arm would get really itchy. So I looked online and found these ones, and he said, no, we don't need that. It's just a waste of money. And then I said, I'll order one to try, and he loved it, and he said he'd never go back. I was right again.
Very good.
I'm a very good translator.
We met in medical school when I graduated.
How does that even happen?
I graduated from medicine when I was 23 years old.
I think she's the youngest doctor in the world.
No, I'm not.
Very smart.
So I went straight through an honors biochemistry undergraduate, 3 years of that, and into medicine. So I did my rotating internship in Akron, Ohio, and started working in New Brunswick, where Jeff was doing his internship. And then we moved here in 1990. I was very pregnant with our first child, and all of our 9 children were born at the Penticton Regional Hospital.
Molly, Hugh, Rose, Katie, Angus, Maggie, Bruce, Emmett, and me.
Well, it's only 15 years from start to finish.
Yeah, Yeah, it's about 2 years. On average, it's 2 years
Every
between
20
each
months,
of us.
whether we needed a baby or not.
Hi, I'm Molly Constantine, formerly Molly Harries, and I'm the first of Leon and Jeff's 9 children.
And I'm Rose Harries, and I'm the third of the 9.
It's a lovely place to be, right? When you go visit, like we're there for like a dinner and there's like 26 people. And you think, well, why would you have so many people? And then you go, okay, well, 11 of them live here. So it's not really as big a crowd as you thought.
One special thing that I've noticed about him over the years is how we all love talking to him. So there's always someone like perched on a counter talking to him, and he's just such a good listener, and he just listens, and whether you're crying or you're happy and telling him a story, he's always ready to listen. That's one of the things I love most about him.
Yeah, I'll just second that. I've only been a nurse for 2 years, but it's nice. I come home from my shifts, like night shift, I'll come home at 7 and he'll be awake and we'll just sit there and chat about the shift and everything. It's been nice to be close to home and chat.
I think being part of a medical family is a way of life, you know, that when we get calls and there's medical emergencies, that has to take priority. So, yeah, a lot of waiting around. But also learning about empathy and care, compassion for others.
Leona's much younger and smarter than Jeff, and they decided to come to Penticton and start a practice together with one other physician. And it was really a really amazing practice. I think they support each other really well.
We had quite an open book practice. You know, we had pictures of our family all around the office as we do here, and talked about our children. So everybody knew the kids.
Yeah, they
recognized them.
people
the
would always
community.
come up to us.
We worked on Ellis Street together for over 30 years.
Forever.
Jeff was developing some really novel ideas about how to treat overuse of alcohol.
The idea is that you can take a medication over a period of time, and that may actually be not for a long time, but it reduces the cravings, allows your brain to heal, and then you can move forward from there, which is another interesting thing why he stumbled onto it, because he's a curious kind of guy, but I could say some more about that later maybe.
I read an article in a Lancet medical journal that described there was something else that could be done, which was a medication that just, for some people, flipped them so they didn't feel like they needed to drink.
These certain medications can help relieve cravings in different ways depending on your history and your genetics.
You know, people text me about how these medications have changed their life or how they're feeling.
Jeff has thousands of patients that he's treated, and hundreds I would expect with alcohol use disorder, maybe even thousands. And that experience of doing that and what you learn about people and how you've changed their life and their families, I think that's, you know, pretty important.
I never had a relationship with alcohol until I was probably a new mom. And that was kind of my excuse. I'm a wine mom. So I started drinking like early in the afternoon, 3, 4, when I was just starting to make dinner. And that's when I really started to enjoy drinking. It wasn't to excess at that point, but that's how it did start, was kind of the wine mom culture. And at first it was just half a bottle of wine with dinner, and then again, full bottle. And then I was getting boxes of wine. And these boxes of wine would only last me 2 days, so that would be two and a half bottles in one night.
When I went through medical school, I was taught that alcohol use disorder was caused by people's moral failing, weak character, bad judgment, bad choices.
We know from the science that's simply untrue. That isn't it. Like, this is a thing that changes how your brain is wired and operates. That's not a moral failing. and it's repairable, which is the good news.
I did find counseling, but the counseling wasn't quite enough. Wasn't quite enough for me to stop drinking.
In the past, we have our hand on our hip, and we describe, we sort of indicate, yes, this is very serious, and it's too bad you find yourself in this position, but it's, it's kind of your own fault, a little bit of that, and really, how could you have been doing this to your family, and don't you see that, the wagging finger comes out. And so what that's caused is people don't think that there's anything that can be done other than what they've already been trying to do, which is stop drinking.
When I was sitting there in counseling, all I could think about was alcohol. When was my next drink? It was just flying right over my head. I needed something just to focus. I did see a little stack of cards on my way out. It said Jeff Harries. And I picked one up and I phoned it just on a whim. I was upset, I was angry, and I thought, what do I have to lose?
Their chemistry is supported by these meds. It doesn't need the alcohol as much or at all. And then they can just get on with their life.
Jeff was one of the most kind and patient doctors I had ever spoken with. Before then, I truly thought I was going to have to die with this disease. And I was so embarrassed about it that I had some pretty bad thoughts. Because I had been shut down by other physicians saying, willpower, and we'll just stop drinking then, and, get it out of the house. But Jeff Harries, he gave me that first boost up out of the hole. And then I could do the rest myself.
A lot of what I've learned in the last 3 years in giving these talks is that hope is such an important part of them recovering, for them to have hope and for people around them to have hope.
The doctors are starting to prescribe more of those medications, and I found it really exciting, and really makes me happy to see that.
He thinks outside of the box, and comes up with notions that other people wouldn't necessarily have thought of. He researches things extensively. He's very knowledgeable, and I would say very self-confident, courageous. So he tries things that maybe aren't conventional or standard fare and has success, and takes it from there.
He's just kind of like a man of the people, and he just has a genuine warmth about him.
I can actually see it. I think the attitudes are changing in people. We're in a city where there's probably more knowledge around alcohol use disorder than any other city in the country. That's really from the work initiated by Jeff. I think ending up doing over 150 talks to 4,000 people. The dispensing rate for naltrexone, which is one of the main medications, went up 450% in 18 months as a result of these talks. We saw a 35% drop in demand at the hospital and a 15% drop in admissions. Awareness of this treatment approach is growing throughout the province, and you can see communities taking ownership of it and integrating it into their processes.
And it was just a pleasure to meet him. He's just a lovely man who has such a passion and care for what he's doing, and also knowing how many people's lives could be changed in so many better ways, families, right?
I attended his workshop, and I was just like in awe that this sounded too simple. But it also made sense when he said that we've tried all avenues to address the alcohol use disorder except for the medical model.
Right away when I got here, Renata and Lou both told me about
this amazing tool that I can have in my toolkit where not only can I meet someone and ask them to trust me, but I can provide them like a soft comfort so that they're not under so much pressure and they get a chance to think for themselves and not have that little voice on the side of their shoulder always beacon in their ear.
When I message anything about Dr. Harries, usually I'm talking to family members as well, and I'll tell them there's hope. There's hope because right now they don't see any opportunities for change or for any kind of solution. But I really promote that there is hope out there.
A very big part of this is providing hope, not just to patients, but to providers, to people who are prescribing these medications, to learn something that's different than what they learned at med school.
Well, Jeff is a very well-respected physician and a very loved member of the community. Everyone knows him. Like I was saying, there was how many people? I probably left out a bunch of people that said, oh, you need to meet Jeff. I had heard about how his work was spreading, how his treatments were effective. He has decades of history of his care and compassion and success with patients. First and foremost, I'm defined as a family physician. A lot of the work that I do is mental health and addictions medicine. I mean, addictions medicine itself, which makes it so challenging and so important, is that it is attached to every aspect of life and most aspects of health.
So failure demand is when you fail to do something in a way or place or manner that would have prevented the demand that you're now dealing with. So the prison system is filled with people who are there because of alcohol.
Drank quite a bit, like got me into a lot of fights, that's for sure. Go to parties, one thing led to another, get into a bunch of fights, and then pretty much what landed me here, which big eye opener. It's the longest I've been sober in like 4 years.
So another part of this new standard is actually to reduce the number of days you drink, or reduce, if you do drink, heavy drinking days, which is a very different approach. It's more kind of moving towards what might be ideal rather than having a binary yes, no, this is good, this is bad.
You know, there's so much focus on abstinence. And it can work for some, but, you know, those people that were marginalized because it didn't work for them, and they're considered a failure because it didn't work for them. Either they didn't complete a full program, or they completed a full program 3 times, 4 times, 5 times. I mean, the problem with that is each time you fail, it sets your mind up to believe that you're gonna fail the next time anyway. Yeah, Jeff talks about hope and compassion, and without these, you can't start. You can't even begin. There's nowhere to go. I see so many patients that are hopeless, and they've given up. They've given up on everything, themselves, their family. They don't think they can make amends. They can make changes, that they can get over drinking or get past the damage that they've caused in their lives and other people's lives, and they're just broken.
I started drinking the day my dad was killed in a logging accident. I started drinking that day, and I haven't quit the only time I've been sober is being incarcerated. It's always caused me grief, but I never took any steps to address the issues. And of course, underlying issues of why I drink, right, through loss. I had one accident in 2014 or 15, I believe. And it was a suicide attempt for myself. And I took a car and I was planting a pole. And I spun out on a corner on the way, whatever I was doing, I don't know, going at 100, 120 kilometers an hour or something. I spun out of control and I hit the pole backwards, actually. It's probably what saved my life. I don't think I had a seatbelt on at the time.
You take most assaults, it's because of drinking. A lot of the vandalism, the kids get drinking with a bunch of people, then they start damaging things. People do things they just would not do if they weren't under the influence of alcohol.
Just all my friends are drinking, and then I went to a lot of parties all the time, and there's always drugs and alcohol, and then a bunch of teenagers drunk and high, never is a good thing. They start fighting, and cars are getting stolen, fights are breaking out, cops are coming, and then fights with police. It's never good.
We certainly are the frontline people. We see these people when they're at their lowest. We see these people when the alcohol has ravaged and caused so much destruction in their lives.
I'd end up blacking out, and that's when I get really aggressive. I black out, and then I don't know what I'm doing. End up getting in a fight or something.
And there's another interesting part, which is particular for people that consume a lot of alcohol, is that the executive function, the frontal part of your brain, doesn't actually work. The executive function, which is for complex decision making, basically doesn't work. The signals don't go to that part of your brain, because you go, well, how could you make a decision like that? And you go, well, because that part of my brain doesn't actually, where I need it to make a complex decision, it doesn't actually work.
Looking back at the debris field of damage of relationships and all the way, always blaming the death of my father, it's like, wow, it's all been my choices the whole time.
And I'll tell you, most of our calls are related to alcohol or drug abuse. If you go into cell block at any given time, most of the people are in there because of what alcohol. Whether it's a one-time get too much and get fighting, fall down, get hurt, or somebody who regularly abuses it. I would say pretty well most of our domestic violence situations, either one or both of the people have been drinking. This story just repeats itself so often that if we could stop that cycle and we're able to help these individuals, because they're great people, the liquor has taken that away from them. It's robbed them of that. Being that great person, that great family person, that great community person, it's just destroyed them, and we see that, and you feel so powerless. We release these people on a regular basis, knowing full well they're coming back. As frontline people, need to have somewhere that we can take these individuals if they want to learn more about the medication. Not just say, hey, by the way, there's medication out there that can help you. See you later. We need something to follow up on. And I'd say, you know what? If you want, I have somewhere to take you right now. I'll put you in the car. I'll drive you there, and these people will help you if you're serious about curbing your addiction to alcohol. Great. And I'm telling you, most of the ones I deal with will do that.
The Canadian Alcohol Use Disorder Society was formed about 5 months ago, and it was really Jeff's idea that we should put in place an organization that can help promote this understanding, provide hope and compassion for people in a different way that's been happening in the past, and expand that understanding so that there isn't this failure demand. I mean, you look around, it's immense. It's huge, and it doesn't need to be there.
The vision, the perseverance, and the courage to keep pushing is what it takes to change a system.
There's too much at stake to stop doing this. Because it was running ahead of what the plans were and how the lumbering system was trying to catch up. So they said, well, you stop and we'll catch up. He said, how about I'll just keep running and you catch up. So it isn't that we're resolving the problem, we're dissolving it, I think. And I think you see their children behaving in the same way, right? That two of them are nurses, for example, the girls, and they're helping and teacher, and you know, they're helping others in sort of something they learned from their parents, I suspect. Right?
If I asked one of my parents a medical question, like if they thought something was infected and I didn't like their answer, then I'd get a second opinion from the other parent, which I always thought was hilarious. And I take the more dramatic answer.
I'd always, like, if I wanted it played up, I'd ask my dad, and like played down, ask my mom.
Jeff was diagnosed with ALS, Lou Gehrig's disease, in May of 2018. And so that's has of course a huge impact on his health and his family. And so it's been difficult. He's pulled back a little bit, but hasn't stopped.
This ALS is like a whack, you know, it's obviously a big deal. But I've always been someone that sort of looks at things, you know, the glass is half full kind of person. And I looked at it as being, you know, it could have been diagnosed with, I could have dropped dead in the night with a heart attack. I could have had pancreatic cancer and died 3 months, you know, after diagnosis. And so ALS has sort of allowed me to better appreciate my own mortality. And interestingly, there's some things that are similar with my health issues with anyone who has health issues, and that is, and in particular with alcohol use disorder, and that is hope is such an important part of dealing with health problems.
That's the reality, right? That he's going to die sooner than most of us. That's just the way that disease works, right? So being able to spend time and help other people is pretty important. Well, it's kind of critically important. So impressed with what he's been able to do. And they're not easy circumstances, and on top of that, he's done just really tremendous work, and it's having a huge impact on a lot of people. And so I probably haven't congratulated him for that, but I congratulate you, Jeff, for the really outstanding and amazing work that you're started, and I know will continue. So when people have that option, you're more likely to be able to engage them in a discussion about because it is an option, right?
And they may decide in the end that abstinence is, or close to abstinence is a better fit, but at least you're into the conversation now. And then it's not a huge deal to participate, and then, wasn't as big a deal as I thought.
It strikes me that a lot of stuff in healthcare, because of the training, is binary. It's either off or it's on. And which is a lot of healthcare is actually driven by setting a specification that says this is an appropriate number of infections to have, and if you have more than that, that's bad, and if you have fewer than that, that's good. And there's a whole movement in quality around aiming for what's ideal, and any departure from what's ideal leads to a loss. So that's more like the world works, right? It's not binary. Like if I have 3 drinks, you can only have 3 drinks, but you could, 4 is bad and 3 is good. Well, where did that come from, right? So if you said ideally, yeah. I'll pretend I didn't see that. So, so now that we've discovered the source of that wisdom, we can move on to say that. So the idea that you could have a discussion about, ideally, I'd like to kind of end up here, right? That's a lot better than just saying, well, this is good and this is bad, and you draw a line, and if you step on that side of it, it's bad, right? So I think it's a better informed way to look at, because that's how the world works. Like, ideally, where would you like to be? And then any departure from that is less than ideal, right? But it doesn't mean it's suddenly good and suddenly bad, right?
These two have always been best friends. They're fabulous brothers, very funny, intelligent, and wise. And
Yeah, and Jeff
especially Jeff
fills in. Yeah, especially the big guy. Yeah. What's really his participation in the panel that drew up the new guidelines in the BC Centre for Substance Use. So that's been great because there's now, when people are looking for what's a solid, credible resource for these practices, they can go to the BCCSU guidelines, and those are, I would say, the most advanced ones in the country.
Yeah. You get credit too.
The BC Centre for Substance Use created an award based on Jeff's work.
BCCSU created it just for him.
It's called the Trailblazer Award.
And it's given to a clinician who is kind of out front, as the award would suggest.
And his brother Bruce handed it over.
A bunch of people from the BCCSU and who is it?
Interior Health Authority.
Interior.
Very lucky. We both love what we've chosen to do for work, and we love each other. And we've been very, very lucky with this large family we were blessed with. We've had a lot of joy in our lives.